the situation at the Southern DHB and more particularly at Dunedin Hospital. We've covered this at length over the past fortnight, as you know. But tonight we have an internal document that seems to make sense of much of what we've been saying. Checkpoint has been leaked a joint letter from some of the hospital's most senior medical staff to representatives of DHB management. It was sent in April. We're going to read from it at length when the Minister joins us later live here in the studio, but it describes a slow-motion train crash and says, quote, nothing has been done to prevent the crisis the DHB now faces. More on that when the Minister joins us. He's coming in from the airport now. But we begin with one more example from the urology department. Ewan Kirstens went to his GP late last year. Routine checks found elevated PSA levels in his blood and an enlarged prostate. Was it cancer? His GP sent him to Dunedin Hospital for further tests. Ewan Kirsten himself takes up his story.
This happened in December. I wasn't even seen in the hospital just for the initial cursory examination until March. And at that point I was told I'd get a biopsy within a month or two. After 3 months I rang up and they said it was now looking like it'll be 4 months from that point. And I rang up again a few days ago, and they now said she couldn't even tell me when it would be, and that they were still working their way through people from December.
So your first visit to the hospital was in December of last year. We are now in August, and you still don't know when you're getting a biopsy.
That's right. That's exactly how it is, yeah.
And therefore, you still don't know whether you've got cancer.
That's right.
Ewan, we're about to talk to the Health Minister, well, a bit later in the program. What would you like to say to him about the situation that you are experiencing and lots of people that we have spoken to or heard about over the past few nights on Checkpoint are experiencing?
Well, I'd like to tell them that they've got it all wrong. That it seems to be all about money. You know, I'd like them to really, give a damn, and just adopt some policies that make sense.
Ewan Kirstens, who went to the hospital after his GP referred him last December. He still hasn't had a biopsy. Dr. Daniel Pettigrew is Ewan's Dunedin GP. He told us this afternoon Ewan isn't the only one of his patients waiting for a biopsy. In fact, Ewan's wait is at the shorter end of the scale.
Basically, I've got 4 patients who are waiting for biopsy, and they've been waiting for between 7 and 14 months for that from referral.
Wait a minute. 4 patients that you have referred on the basis of the possibility that you have seen as their GP that they've got prostate cancer?
Yeah, that is correct, yeah.
And they've been waiting how long for their biopsies?
Most of them, they've all been seen in clinic within 6 months, but then there's the wait time to biopsy, which is even longer. So I've got one patient that's been waiting 9 months for his biopsy and still hasn't heard anything. Most of these patients will be seeing me in the meantime. So often as part of their care, I'll send another letter through to urology. And that's the other thing that became apparent, is that I'm just sending letters left, right and centre, reminder letters essentially. Please see this patient who you told me you're going to do this biopsy on or you're going to see.
Do you get replies?
Not usually, no, but sometimes we get action quickly, but not all of these ones have.
And so what's your sense? Are these delays, these waiting periods, too long?
Oh, absolutely, they're too long. They're outside the department's guidelines, they're outside the ministry's guidelines. And patient experience of this is not just frustrating, but actually quite concerning. Patients are worried about, have I got cancer, or am I worrying about nothing? And we'll be sort of babysitting the patients through this. We'll recheck some blood tests, we might check them again and say, well, it doesn't look like it's getting any worse, or, well, actually is getting worse, let's try and hurry this up a bit more.
Have you seen, sorry to interrupt, have you seen situations where it is getting worse and they are still not being seen?
In terms of diagnostic probability, yes, I guess. There are patients whose for example, the blood test, I will repeat the blood test just because we want to know, is it getting worse? And yes, they are going up. So, yep, we are seeing that.
What are the symptoms? What are people... So when you refer someone to Dunedin Hospital for a prostate biopsy, what are the symptoms they're presenting with?
Sometimes they will have no symptoms. Usually they will have been tested as a part of a workup for symptoms like difficulty passing urine or going more frequently overnight, those kind of things. But then as part of the workup they will have had a prostate check, which will usually involve both a finger up the backside and also a blood test. So it will usually be on the basis of one or other or even both of those.
So you do the finger up the bum and the blood test before you refer them to the hospital, and you refer them to the hospital on the basis of what you find in those tests.
That's correct, yeah.
And then you have had people waiting for up to 9 months for a biopsy.
Yeah, and that's after having that particular chap had been waiting 5 months to be seen in clinic in the first place. So he's actually been waiting 14 months now from the point of clinical suspicion. And does he know whether he has cancer or not after 14 months? No.
Is this good enough?
No. I think, can I just break in here as well? Because I think the other thing just to highlight here is, while there's all this beat up on urology going on at the moment, this is not just a urology problem at Southern DHB. We are experiencing similar, maybe not to the same extreme, but similar kind of experiences with referring patients to many other departments in the Southern DHB. And, there's obviously been stories in the media about surgery and ophthalmology and various other departments down here, but it's across the board.
And can I ask you, so far you have talked to us about your absolute experience of referring patients and watching them wait and wait, but now I guess I'm asking you to try and do a big picture take on why they're waiting so long. Do you think it is because of insufficient resources?
Oh, absolutely. I mean, as much as the Minister may say, we've got to do more with less, the reality is you can only underfund a health service for so long before that starts translating to the frontline services. And that's exactly where we are now. I mean, we're heading towards a third world health system here.
That's Dunedin GP, Dr. Daniel Pettigrew. Now, we have this extraordinary letter that it's been leaked to us from senior medical staff within the DHB. The Minister is coming from the airport and he will join us in the studio, and there is much to discuss with him. Do stay with us. The Health Minister Jonathan Coleman joins us live here in the Auckland studio to discuss the unfolding crisis at the Southern DHB, and in fact we have an internal document that uses that word, crisis. But first, let's hear again from the patients, their families, the doctors, the specialists, and even welcome, Minister.
Hi, John. How are you?
Yeah, very good, very good.
Well.
Yeah, good. Yeah, good.
Excellent.
Now, so we're just going to play a track, right? And so we're going to look back over our coverage of the past week or two, and we're going to listen to patients, families, doctors, specialists, and even DHB bosses who all agree to varying degrees that whilst the staff are doing the best job they can, the situation at Dunedin Hospital is untenable, and they need an urgent cash injection from you, the Minister. So I'm delighted to have you here so you can listen to this.
To be here.
Yes, so listen to this package. Bridget Burke put it together, and it begins with Bridget Telfer, the daughter of Mosgiel pensioner Merv Telfer, who has had his cardiac surgery cancelled 7 times.
16th of May, he was told it was urgent, and they hoped to have it done in 30 days. And what he was told was that, yes, he definitely needs a heart valve replacement. He definitely needs a double bypass, but once they get in, it could be triple, it could be quadruple, they won't actually know, and that his arteries were 80% blocked.
Okay, so he was told that in May, and since then it's been postponed 7 times, including twice after he was admitted to hospital.
Yep.
68-year-old Owen Glover died last year after his heart surgery was postponed by the Southern DHB. Here's Owen's daughter, Donna.
So they made and cancelled 4 appointments. The 5th one was supposed to be towards the end of August last year. Unfortunately, he died at the end of the first week of August, so he didn't make his so-called confirmed surgery. And like I said, he was 68.
And what did he die of, Donna?
He died of heart related. Basically, his heart just gave up and stopped and just couldn't do it anymore.
And how many times had his appointment been cancelled or delayed or deferred?
4 times.
Nigel Miller is the Chief Medical Officer of the Southern DHB.
We sincerely regret finding
ourselves in that position of not being able to meet their reasonable expectations of a surgery taking place. So I absolutely agree with you on that. It's not where we want to be at all. It has been happening more often of late, and I think that's an unsatisfactory situation, I think, as we discussed yesterday. And so we're in a really difficult place. Our clinicians are faced with this really difficult challenge, the difficult problem of, do you select the patient with cancer? Do you select the patient with scoliosis? Do you select the patient with cardiac problems? Each of which is going to suffer some significant disadvantage and potentially some harm if you don't do it straight away.
Paul Schofield paid for his own biopsy for prostate cancer in February. He's been waiting ever since for surgery that ministry guidelines say should have been done within 31 days.
The minister, who's refusing to take calls from Checkpoint, is a coward. This situation is it's just unacceptable. It's obviously a failure in the system. And, whatever happened to ministerial responsibility? It's just one other thing I'd like to say. You've got a perfectly good private hospital there that's got the facilities and the gear to do it. So this is purely and simply money. It is nothing more than that. They have saved $11.5 million of their deficit by cutting back and putting people's lives at risk. I wonder what a coroner would have to say about that man that died because he was unable to get his heart surgery. And I certainly don't want to be in that category because of the incompetence of a group of people. And that's, I'm sure, those other people who are affected just like I am feel exactly the same. And I know that my family are very angry about this.
Graham Woodside is the Chief Executive of Prostate New Zealand.
Far from satisfactory, John. The faster cancer treatment program stipulates that if somebody's got a confirmed diagnosis, they should be treated within 31 days. Now, that's 1 month, not 5 months.
Dr Daniel Pettigrew is a Dunedin GP.
Basically, I've got 4 patients who are waiting for biopsy, and they've been waiting for between 7 and 14 months.
Do you think it is because of insufficient resources?
Oh, absolutely. I mean, as much as the minister may say, we've got to do more with less, the reality is you can only underfund a health service for so long before that starts translating to the frontline services. And that's exactly where we are now. I mean, we're heading towards a third world health system here.
Kelly Gibbs's severely disabled daughter Amber had her scoliosis spinal operation cancelled as she was being prepped for surgery because of a shortage of ICU beds.
Amber's got a lot of things wrong with her. She's actually got microcephaly, scoliosis, cerebral palsy, epilepsy, developmental delay, and she has asthma. We had her all gowned up, ready to go, and the next minute the surgeon comes into the room and says to us, "We're sorry, but the surgery has to be postponed because a young guy who's had a heart attack has taken Amber's bed in ICU and they're needing a triple bypass."
Chris Fleming is the Chief Executive of the Southern DHB.
I believe that patients' care has been delayed as a consequence of delaying cases because of lack of ICU capacity. We do not have enough ICU beds, absolutely. I do apologise. The number of cancellations is just not acceptable.
Dr Alistair Hepburn is one of the Southern DHB's 3 urologists who share 2 full-time roles. He says the department is understaffed and this is delaying the treatment of cancer patients.
One of the major problems, yes. It's not the only problem, but it is one of the major problems.
People with prostate cancer?
Correct, yes.
Other forms of cancer?
Definitely, yes.
This is a difficult question for you to answer, and
Sure.
You are in a master-servant relationship with the Southern DHB, even though you are a senior urologist. But do you feel like there are real financial pressures driving what appear on the face of it to be insufficient staff numbers?
I can say that's the feeling I get, yes.
Stephen Mark is chair of the Urology Society.
There is a crisis of patient care because they've got concerns about the inability to deliver the care in the time frames that they wish to do so.
Kathy Grant is the Government Commissioner appointed to the Southern DHB by then Health Minister Tony Ryle in June 2015, after he sacked the board.
If Paul Schofield has now been waiting for over 4 months and has absolutely no idea still when his cancer is going to be treated, is that satisfactory, do you think?
No, it isn't. It isn't satisfactory. The comment that I would make is that Southern has suffered from really years of underinvestment and significant deficits. So the pathway forward is going to take a period of time. There is no
which is well, absolutely, which is all very well and good when we're talking about financial KPIs and deficits and budgets and bringing things in under what the government requires of you. But if you have prostate cancer and you are waiting for treatment and you don't know when it's coming, do you think that you want to even hear those discussions taking place?
Probably not. I acknowledge that the delays are regrettable, that the patient groups that you have been talking to do need their surgery. We are making progress. We are investing in the future of Southern DHB and initiating change.
Here's Prime Minister Bill English yesterday.
You need to ask the DHB. I mean, they're responsible for providing services. They've got some targets they are meant to adhere to, which represent good service for the public. And I would hope that if those 10 cases aren't getting the service here, then the DHB make sure they get it somewhere else.
Health Minister Jonathan Coleman, it's nice to have you with us.
Good to be here,
on
John.
Checkpoint. Thank you. What do you make of all of that?
Well, look, I've got every sympathy for those people who we have heard from there. I mean, clearly they've had unacceptable service. But look, the big picture is this DHB was the worst in the country, and that is why I sacked the board back in 2015.
Financially the worst in the country, right? They had the biggest
Financially the worst in the country, but I tell you what, if you don't get the finances right, you can't provide the clinical service people deserve. And this has to be turned around. Those people should get their operations within the specified time. So things have got to change at Southern. There's a couple of departments there which I think need a real focus on clearing those waiting lists. We heard there from the urology or cases related to urology. Chris Fleming, who is doing a very good job as the CEO, as is the Commissioner, they are going to be receiving a review of that department. They tell me actually that of 10 patients who are waiting variable times for urgent radical prostate surgery, half of them now have waiting times, but they've got to do better. It's unacceptable when people are not getting their surgery within the waiting times that they should.
We've just received this email from a person who wants to remain nameless. I'm 57 and after repeated high PSA tests and DRE, which is digital rectal examination, late last year, which showed my prostate was enlarged, and the fact my father passed away from prostate cancer, I was put on the urgent list for a biopsy in January. I chased up repeatedly and finally thought I was getting my biopsy about 6 weeks ago, but it turned out to be just 10 minutes with a specialist designed to screen out non-urgent cases and reduce the list. So this man has a family history, he has an enlarged prostate, and he has high PSAs. He still hasn't had a biopsy.
Yeah, and that's unacceptable. So the DHB needs to explain why that's happening, and those answers need to be provided in the review. But the key thing is, people like that gentleman, they have to be getting their surgery, their testing and then their surgery in an acceptable time, because there's been plenty of money going into the DHB. We use the same funding formula for every other district health board in New Zealand. Other DHBs are able to manage not only within their means, but crucially provide the surgery when people need it and within the specified time frame. So that's not acceptable.
Yeah, okay. Let's talk about what the doctors themselves are saying.
Yeah.
Because, look, we've spoken to the CEO, and he was in that package, Chris Fleming, and he talked about an inadequacy of ICU beds. He talked about excessively long waiting lists. We spoke to the Commissioner that you appointed 2 years ago, who conceded that people were waiting too long. We spoke to the Medical Officer of Health, Nigel Miller, who says things aren't as he would like. But what we've obtained today is an internal document sent by a group of senior doctors in April, talking about the completely predictable nature of this crisis. Inadequate theatre access in Otago. Some patients have little chance of getting an operation. They describe it as a slow motion train crash, and they say it's unfathomable how this situation has been allowed to continue. Now, it's all very well to say something is going to be done, but when?
So things are being done, actually. If you look at the number of operations in Southern, they've increased by 33% over the last 8 years.
Minister,
more surgeries all the time. Yeah, ICU beds, John. Let me just finish on ICU beds. So there's 9 available ICU beds. Chris Fleming has a plan.
8. We're going to 9 at some stage next year.
8. They've just approved the 9th. No, they'll be going up to 18 next year. They'll have the capacity to go to 18.
My understanding is they're going to 10 next August, right?
No, what they've told me is they will have the capacity as needed to expand to 18 on an as-needed basis in August.
Okay.
I've just got off the phone to Chris Fleming. He's confirmed that.
Yeah. Okay, well, Chris Fleming said to us 10 last week. So
no, but there's another 8 HDU beds that they can turn into ICU beds when needed. Now, clearly, with these patients we've just heard from, I would expect those HDU beds to be used as ICU beds. So there will be a doubling of the ICU capacity at Dunedin Hospital by August. That's a pretty big increase, and that will avert a lot of these issues.
Yeah.
So you ask what's being done? That's what's being done.
Within a year.
And that's what counts for the public.
In the meantime, cardiac surgery is being postponed. Surgeons are writing internal memos saying they can't do the work. I want to read
So cardiac surgery, okay. So Southern are implementing a plan to get all those people treated, and I insist that they do that. Same with the prostate surgery. Those people have to have their surgery. The public need to get the treatment that they deserve because there's plenty of money there. Just the management needs to get their act together to deliver services. And this is the whole reason I had to sack the board in the first place.
Okay, but you put your commissioner in June 2015.
Well, she's got a huge task.
Well, hold on a second.
No, she has got a huge task.
If you sack the board and appoint a commissioner, when is she going to start delivering? Well, she's not.
No, John.
Look, her surgeons say she's not. The patients say she's not.
No, they're not saying that. She's totally delivering.
Well, what?
Okay, so there's 2 aspects.
Sorry,
John,
Minister, have you been listening to Checkpoint over the past fortnight?
Yep, I've heard all that stuff.
Did you hear that piece we just played?
I was in Dunedin last Friday talking with people about this issue.
I don't want to have an argument with you, and we really appreciate you being here, but I cannot recall such a sustained attack on a public hospital in my career in journalism, which stems back to 1989, than what I have heard from patients and people who work at the DHB over the past fortnight, and they are consistent in their thesis that they don't have enough money.
Well, look, John, that is not correct. The money has gone up by $40 million last year, an extra nearly $250 million over the last 9 years. The budget now is $923 million per year. It's not a matter of money. The Commissioner's done a very good job. She has halved that deficit from $42 million to $21 million this year. It'll be $14 million this year. How did she halve the deficit?
That's the problem. You've given her financial KPIs, haven't you? That's
but it's not at the expense of patient care. Patients come first. That's absolutely. I'm in this job.
Why are you the only person who was saying that to me?
No, John. Other people are saying that as well. Patients come first. Look, I wouldn't be doing this job as Health Minister if I didn't have a deep and very sincere dedication to providing better health services for New Zealanders. That's what we focus on every day. Across hundreds of health services across the country, you would struggle to find more than a very handful that haven't improved. Now, obviously, urology in Dunedin is a problem. It's been described to me today as a toxic department. They've got to sort their act out there. They've got to provide the radical prostatectomies, the urgent testing that people like those, really good down-to-earth New Zealanders we've just heard from deserve and should get.
Right, so urology's a problem. Ophthalmology has been a problem in the past. You talked about people waiting for cardiac surgery. ICU is a problem. Tell me what parts of the hospital are going as you would like.
Look, the whole thing needs to improve. That's why we've put the Commissioner in. But this is a big, complex service.
2 years ago,
Minister. Come on, John. Look, you can't go like that.
You sacked the board. You put in a Commissioner. You gave her financial KPIs, and she has halved the deficit. But as everyone we are talking to is saying is to us, at a cost.
No, John. Look, the patient care comes first. Her job is actually to get the finances in a stable condition. The reporting under the old board was up and down. Their figures changed all the time. She's doing a much better job than the old board. But the key thing is, without that clear picture of the finances, you cannot improve patient care. And the big thing is, we're going to be rebuilding Dunedin Hospital. So the indicative business case, is being considered by Cabinet. There will be a new state-of-the-art hospital in Dunedin. There's no question things need to turn around.
When?
Now, when?
When?
Well, look, you'll see it when the indicative business case is released, and I can't preempt that. But I'm quite happy to come back and talk to you here about it.
Yeah, okay. Can we look at a text we just received? My husband has to wait 40 weeks for an MRI to rule out a brain tumour as the cause of hearing loss in one ear. Now, this goes back to what the surgeons are saying in that internal document in April. They are not able to do very basic work, because if they assess that person had a tumour, they would then have to do something about
but John,
it.
that's a little bit unfair. We don't have the context around that case. If that person would like to email me at Parliament, I will personally look into that case.
Can I read out from that letter again? A full-time general surgeon in Dunedin operates twice a month in the operating theatre.
Sorry, who's this
Twice
letter
a
from?
month. This is an internal letter sent in April to senior managers at the DHB from senior doctors at the hospital saying, we've had a guts full. This isn't working. It was leaked to us today.
To be quite frank with you, I struggle to believe that a full-time general surgeon is only doing 2 lists per month. They'd be doing 2 lists per week. Are you sure you're reading that?
2 lists per month, operating twice a month.
Well, we need to look into that, because that just doesn't sound plausible.
Okay, the CEO of Mercy Hospital told us that every time somebody is stood down because of an inadequacy of ICU beds, the surgeon, who is very often prepped and ready to go, does nothing that day.
And that's why the ICU beds are going to be doubled in capacity
by when?
By August.
By August of next year. A year away.
25 million.
A year away.
John, 25 million being invested in these services in Dunedin Hospital to keep them going prior to the rebuild. A doubling of ICU capacity. Oh, look, I agree with you. Those stories we've heard are unacceptable. And that's why Chris Fleming is taking action. That's why the ICU beds are being doubled. And the wider context of that is we're rebuilding the hospital. There's an extra $250 million of funding that's gone in, and surgeries, elective surgeries, have increased by 33%.
Minister,
over the 8 years. Well ahead of population.
Yeah, absolutely.
Yeah.
But you and I both know that the elective surgeries that have increased by 33% are the smallest and easiest ones to do.
That's not correct.
That is absolutely correct.
It's not correct.
We're talking about trouble at the heavier,
No, that's not correct.
the more surgical end of the hospital.
All elective surgeries have increased. They have.
Are you happy with what's happening at Dunedin Hospital?
I want to see great improvement. I'm not happy when, let me think. I'm not happy when the people of Otago are having to wait, and the people of Southland are having to wait for surgeries that they should get within a reasonable time frame. That's unacceptable.
Why are they having to wait? If it's unacceptable, and thank you for saying that, why are they having to wait?
Well, look, we're going to find out quite a bit out of that review of the urology department. Clearly, the hospital has not been working as well as it could over some time, and it needs to turn around, but it's not a matter of money.
It's not a matter of money, because everyone else we've spoken to, including the urologists, tell us it's a matter of money. Chris Fleming said,
and you know
when we spoke to him about the ICU beds, we need the money.
Well, he's getting the money for the ICU beds. So you're talking about elective surgery. As I told you, the ICU capacity is being doubled by August next year. That's a huge increase, 25 million going into that, and a huge hospital rebuild, as well as $250 million extra going into that DHB over the last 9 years. And I can tell you the other thing, John, every other DHB around the country is managing to deliver the operations that are needed. This has been the Court case DHB. It can't be turned around in 2 minutes.
Okay, let's look at your media statement when you appointed the Commissioner back in June 2015, Health Minister Jonathan Coleman, who was sitting beside me now, and I'm delighted to have you there. Well, I'm very sorry about that. Your predecessor, this was you.
Yeah, it was me.
Has today written to Southern DHB dismissing all members of the board and replacing it with a Commissioner. The financial problems at Southern DHB are long-standing. I do not have confidence that the current government arrangements are suitable for delivering on the changes required in Southern DHB.
Absolutely correct.
Right.
Yep.
But you were driving monetary KPIs, and you said jump, and they said how high. And what we are seeing here is a direct result of your imperatives to reduce the deficit.
No, it's not. Look, the first thing is, John, you could not have the DHB continuing on that financial footing. Every month the figures we got were different, so you could not plan clinical care. So there's a number of steps to sustainability. It's financial, but it's clinical. The patients come first, it's the workforce, and it's the quality of services. And that's exactly as the Commissioner, I'm sure, would have told you yesterday as well.
We've got 1.5 minutes until 6 o'clock. Katrina's just reminded me that it's impending by walking in behind us. Welcome, Katrina. Can you tell me what people should do in the interim? Paul Schofield, for example, who has been waiting months and months and months for surgery. All the people we've spoken to, can you use Mercy more?
Well, look, the DHB has to have a very clear plan for getting those who need surgery, the surgery they need.
Is that an instruction from the Minister?
Oh, no, they know that. That's how it operates.
But they seem to both know it and not been doing it. What did you say to him today? What did you instruct him to spend more money to get work done?
No, look, he's got as much money as he can, but look, he is an excellent chief executive.
As much money as he can, but not as much money as he needs, Minister?
No, look, I know this is your central argument, but it's not correct. He's got a turnaround plan for all those services. He's going to turn around that toxic urology service. And he told me today, look, the numbers of people waiting for surgery has halved from 10 to 5 for that, radical prostatectomy. So here's the man to turn it around.
Overnight? How did that happen? I'm confused about that. Have some people just been removed from the list? I mean, the thresholds keep...
sorry, let's be clear. 5 of them have got dates, 5 are still waiting for dates.
Okay, they got dates today.
Oh, no, I don't know when he gave them.
They got dates since we raised it, Minister. That's good, though.
Well, I don't know if that's the case. But look, you're getting into a heck of a lot of detail. The big picture is there is enough money there. The Commissioner's doing a good job. We're rebuilding the hospital, and actually surgeries have gone up by 33% over time, and an extra nearly $250 million into the DHB. But performance needs to improve because patients come first.
Health Minister Jonathan Coleman, thank you for joining us.
Thank you, John.
Thank you.